My name is Julia Crowley, and I'm the Director for Management for the ProWash and Scale activity. As background, ProWash and Scale is managed by the U.S. Department of State and focuses on improving the implementation and effectiveness of U.S. government-funded WASH, agriculture, livelihoods, and markets interventions in both humanitarian and resilience settings. So today we're excited to kind of highlight some new exciting results that saw reductions in malnutrition, disease, improvements in livelihoods resilience, and an integrated livelihoods wash and nutrition program in the Drylands of Chad. Over the next hour, we're going to do kind of a couple of presentations, kind of framing the results, and then we hope to have a substantial portion of this kind of webinar dedicated to question and answer, where we can dig deeper into anything that may come up and really kind of understand the kind of links and the links that this has with our activities. So basically, the initial kind of presentation will be a kind of a conceptual framework of persistent acute malnutrition. Then we're going to look at tailoring it to the context. Then we're going to do formative research, and then we're going to look at results, lessons learned, and implications. The first speaker is Gwen Luke. Gwen works with the Office of Emergencies and Resilience at the Food and Agriculture Organization, FAO, at the United Nations, based in Rome. Her work focuses on generating evidence and designing innovative livelihood-based approaches to prevent child acute malnutrition in crisis-affected contexts. With 17 years of field experience, she has extensive experience in research, program development, and policy engagement to strengthening humanitarian and resilience outcomes. And then our second presenter is Dr. Claire Knoll. She is a Senior Evaluation Officer with FAO's Office of Evaluation, based out of FAO Liaison's office in Washington, D.C. She specializes in quantitative impact evaluations of nutrition and WASH interventions, and she was previously the principal investigator for the Kenya site of the WASH benefits cluster randomized trial to reduce stunting among children in rural Kenya and Bangladesh, which was funded by the Gates Foundation. She was formerly on the faculty at Emory University School of Public Health and was a principal researcher at Mathematica. She holds a PhD in agriculture and resource economics from UC Berkeley. So thanks, Gwen and Claire.
Thank you very much, Julia, and welcome everyone. So today we are pleased to present an integrated livelihood approach developed to prevent acute malnutrition among children under 5 in Chad. So this study and intervention presented today were co-funded by the US government and implemented through a partnership between FAO, Tufts University, the government of Chad, and national research institutions such as herein and local implementing partners, including ASHAD. So the government partner included the Ministry of Public Health, Livestock, Water and Environment, reflecting the multisectoral nature of this intervention. So, and also I need to mention that this work is a result of more than a decade of collaboration among multiple partners seeking to better understand the persistent burden of acute malnutrition and how to break the cycle. So in Chad, as in many similar dryland contexts, acute malnutrition has remained persistently high, consistently exceeding emergency thresholds, despite decades of humanitarian investment. So what we've seen is most of the humanitarian effort have been focusing on treatment of acute malnutrition and immediate drivers, for example, inadequate dietary intake or treatment of disease. And while these interventions are essential, they have also limitations. Recent studies in similar contexts have shown that up to 60% of children relapse into acute malnutrition within 6 months after completing treatment. And in addition, the latest global guidance on prevention and management of child wasting have highlighted that evidence based on what really works to prevent malnutrition remain very limited. What we know is in Chad, as in other contexts, acute malnutrition is disproportionately concentrated in arid and semi-arid regions where a pastoral and agro-pastoral livelihood dominate. So based on those elements, it's now increasingly clear that persistent acute malnutrition cannot be addressed by only focusing on immediate causes or treating symptoms. And to achieve sustainable reduction, we also need to really understand and address the underlying and basic drivers, as well as their interplay. Because those pathways are super context specific and also very much influenced by seasonality. So over the past decades, Tufts University, together with FAO and other partners, has refined the UNICEF conceptual framework to better understand these basic drivers. So this is the framework that you are seeing now on the right. So as we all know, acute malnutrition is directly driven by inadequate dietary intake and disease, which impair the absorption and utilization of nutrients. And these immediate causes are themselves influenced by underlying drivers, such as household food insecurity, inadequate care and feeding practices, or unhealthy environment. However, those underlying drivers are themselves shaped by the local environment and its seasonality. So climate variability, access to water and natural resources, institutions governing these resources, prevailing social norm, all influence local livelihood system, which ultimately shape child nutrition outcome. So we also learned that livelihood system influence child nutrition through more than household food security alone. They operate through multiple interconnected pathways that really go beyond the traditional humanitarian sectorial silo. So, for example, livelihood activity influence women workload and then in turn their caregiving capacity for children. But we also know that livelihood also influences health outcome. For example, the way livestock is managed through the season determines and influences child exposure to zoonotic pathways. So which in turn, of course, contribute to non-absorption of nutrients. So taken together, this framework provides a practical basis for understanding and designing intervention that will address persistent acute malnutrition. And the intervention today we will present from Chad definitely represent one of the examples of its operationalization. So now let's look a bit more closely about seasonality of acute malnutrition in Chad. So by bringing together more than a decade of historical nutrition survey, Tufts University and its partners have been able to better characterize the seasonal patterns of acute malnutrition in Chad. And this pattern we've seen in Chad, but in most other dryland contexts. So this work has identified two recurrent and highly predictable seasonal peaks of acute malnutrition recurring year after year. So the second peak, the one that you see happening after the rainy season, is the one most humanitarian interventions are focusing on. It's the one that happened just before the harvesting season and coincide with the tail end of the food insecurity peak. However, an earlier and more severe peak occurs each dry season. And this peak has been receiving far less attention. So this first peak coincides with the pastoralist lean season, when temperature rise, pasture and water become scarce, livestock health condition deteriorates, and milk production decline. So at the same time, we know that a growing body of evidence has suggested that livestock support can play an important role in preventing malnutrition. Studies in Kenya or in Ethiopia, such as the Milk Matter study, have shown that protecting livestock health and productivity and maintaining milk production can contribute to improved child nutrition dry season. So here are the objectives about the Chad study, an example. So building on this background, our research in Chad has two main objectives. The first one was to better understand the pathway leading to this dry season peak of acute malnutrition to allow us to tailor an intervention that will really target those pathways adapted to the local context. And the second objective was really to implement an intervention and evaluate its impact to contribute to fill the evidence gap on what works and how to design an intervention that will prevent acute malnutrition. So let me briefly walk you through the study timeline. So we began with a baseline assessment in 2022, followed by a formative research to really understand the local drivers leading to the dry season peak of malnutrition and really tailor the intervention. Then during the dry season 2024, we piloted the intervention. And then between December 2024 and May 2025, we implemented the intervention with a rigorous monitoring system. And we implemented inline data collection in May 2025 and July 2025, providing the evidence that Claire will present today. So this is an overview of the formative research, what we looked at to really design and tailor our intervention. So it was a mixed method formative research to really better understand those key pathways happening during the dry season and really tailor the key parameter of the intervention. So first, we examined seasonal milk availability and milk consumption among women and young children. And the research confirmed that, yes, in northern Chad, milk is perceived as essential nutrition for the child and their growth. However, milk availability began usually every year to decline around December, January, when pasture progressively disappear. And livestock, most of the herds start moving in search of grazing area, while most women and children remain in the village with few milking animals to provide milk. But at the same time, the limited availability of livestock feed on local market make it difficult for households to maintain milk production through the entire pastoral lean season. So this finding directly informed the intervention. Feed supplementation was designed to begin as soon as livestock started moving and milk declining, to really continue maintaining a certain level of milk availability close to the women and young children during the higher dry season. In terms of how the formative research was also designed, we explore herders' preference and local availability of livestock feed. So really to try to find the right composition to maintain milk production and also ensure the right delivery modality and acceptability for both the local community and the livestock. And lastly, we looked at the potential unintended consequence of the intervention. So, such as keeping more livestock closer to the children and women during the dry season could increase some pathogen and zoonotic exposure. So we investigated those zoonotic transmission pathways, and we looked at direct contact between animal and children, share water sources, milk and food hygiene, and try to design mitigation measures associated to it. We also looked at women workloads and the governance of natural resources to ensure that the intervention will not increase women labor burden or create any additional tension over access to water or grazing land. So this is just an overview of one of the components of the formative research we looked at. So this one focused on the zoonotic disease risk at the livestock environment and child interface. And to better understand those risks, we collected samples from household water sources, livestock feces, animal milk, and child feces, and tested them for pathogens known to affect child health and nutrition. So what we found is that most of the water sources, including protected borehole, were highly contaminated with E. coli and Salmonella. And that contamination was further increased along the water chain of the household. The second is we also detected high level of Campylobacter and Cryptosporidium in parvum in child feces. So it indicated some potential also contamination through other pathways, such as direct contact in the household compound with the livestock, or also the food and milk hygiene. So how we use that to inform the intervention? First, we looked at strengthening animal health through livestock feed supplementation, vaccination, deworming, but also some counseling on improved livestock management practices. Second, we promoted household water treatment using locally available chlorine, eau de javel, that were available on the local market. And we conducted acceptability and dosage testing to identify the most appropriate and acceptable treatment strategy. We decided to go for point of use, so household level treatment, also because we found out that there was a large diversity of household source use, and even the borehole contained some contamination. And we also looked at how to really tailor a behavior change communication package that would include safe water management, milk hygiene, food hygiene, and livestock management to reduce those zoonotic exposure risks. Just a few words on the evaluation. So the evaluation method was a randomized control trial, and in terms of we decided to villages were randomly assigned to either the intervention or the control group. And to ensure balance between the study arm, we accounted for key baseline characteristics, such as the prevalence of child acute malnutrition, food insecurity, livestock ownership, livelihoods, source or income sources, and household water sources. And we also use geographically defined cluster to minimize contamination between intervention and control. Then in terms of the targeting, which is in the next slide, so within each of those villages, we enrolled 20 households, and those were the criteria for enrollment. So to be eligible, household, both control and intervention, had to have at least one child younger than 53 months at the start of the intervention in December 2024, ensuring that then the child will remain under 5 years of age at the end of the intervention. So the second criteria is household had to be identified vulnerable through a community-based targeting process and provide informed consent to participate to the study. The key distinction criteria between intervention and control was about how much livestock they keep during the dry season. So for control group, household continue their usual practice, typically keeping at least one milking animal near the homestead, while the rest of the herd migrated in search of pasture during the dry season. But for the intervention household, households were encouraged to keep one tropical livestock unit. So what is it? It's equal to either one milking camel, one cow, or 10 small ruminants. And they were keeping it in close to the homestead, and to make this possible, the project provided livestock feed to maintain this animal near home and sustain milk production availability during the entire pastoralist lean season. The next slide is summarizing what the intervention looked like in its calendar. So the intervention took place, really was implemented between December 2024 and May 2025, covering the entire pasteurized lean season, and started when the livestock, usually there is a decline in milk production. So the first component focused on livestock productivity and field. So household received livestock feed, locally available and acceptable. So it was cottonseed cake, maize bran, salt lick, and towards the end of the dry season, they also received some fodder. And to maintain, the idea was to maintain animal health and sustain milk production. The second component focused more on environmental health and mitigating all those zoonotic risks through water and hygiene. So household receive locally available chlorine for point of use treatments, together with some soap to really encourage good hygiene practices. And then there was an integrated behavior change counseling component that covered livestock management, household water treatment, food and cooking hygiene, including milk hygiene, consumption of diversified diet and animal food source, and also some infant and young child breastfeeding practices. So I will now pass over to Claire for her to go through the impact evaluation component. Thank you.
Thank you, Gwen. I'm delighted to be joining all of you today. We can move, yeah, thank you. So as Gwen mentioned, 20 households per community were enrolled in the study, and there were 76 villages in total participating. The study was timed around collecting data at the peak of when we expected the worst malnutrition in May 2025. And then we also had a follow-up assessment 3 months later in July to capture longer lasting effects. The data analysis controlled for a number of other sort of concurrent considerations, including whether the households had received other forms of assistance, the baseline indicators that Gwen mentioned earlier, and some of the geospatial characteristics of the sites. Our regression analysis mainly focused on odds ratios, and we looked for statistical significance of at least p-values of 0.05. So here the figure shows the main impact results. You can see the dotted line between the baseline values in December when the treatment and control areas were comparable to the very large difference observed in May. At this point, there was a 71% reduction in global acute malnutrition. So this is children who were 2 standard deviations below the mean, either in terms of their weight for height Z-scores or their mid-upper arm circumference, or who had bilateral pitting edema. At the same time, there was an even bigger reduction in severe acute malnutrition, which is defined as more than 3 or more standard deviations below the mean for either the weight for height or mid-upper arm circumference. A few months later, when we checked again in July and collected the wider range of outcomes, the difference had narrowed greatly. So these results we saw at the peak, but there was still a statistically significant difference in the global acute malnutrition, even in July. The intervention, we also measured a number of other effects of the intervention. So I'll start with sort of tracing through the causal pathway. First of all, we did demonstrate an increase in milk consumption among children, which is what was expected. So there was a 66% increase in the number of households that had milk available on a daily basis, and almost a 60% increase in milk consumption by children under 5. This was also related to improvements in household food security, with a reduction of 46% of households reporting food shortages, and households being 2 times less likely to use negative food-based coping strategies among the intervention group. To then talk about child morbidity. So this translated into also a reduction in acute respiratory infection symptoms as reported by the caregivers, and a large reduction in diarrhea prevalence symptoms as well. These, of course, being also related to the WASH components of the study. And then finally, looking at some of the other secondary outcomes in terms of livelihood, so a reduction of 45% among households reporting distressed animal sales, a reduction of 33% in animal illness, and an increase in goat offspring births among the treatment group. We saw also some improvements in women's nutrition and well-being. Women were in the intervention group were 2.5 times more likely to meet the minimum dietary diversity score, and a reduction of 35% of women who reported daily exhaustion. And then finally, in terms of social cohesion, we saw indications of stronger mutual support and sharing of inputs, tools, milk, and water treatment supplies in the treatment group. So a whole host of improvements were demonstrated. We also did a return on investment analysis. As you can see from the table here, we looked at a number of different benefit streams over the 6-month time horizon of the intervention. And we took a societal approach to the micro-costing using data from the project's records to track costs. We estimated a total cost per intervention household of $370, and then compared that to the benefits across all of these areas we were just discussing in terms of reductions in or improvements in nutrition and reductions in mortality, also the livelihood component of animal health, and livestock capital for household resilience and food security. And the results here are quite striking. So after just the 6 months of intervention, we estimate that every dollar invested in the pastoral lean season in this integrated livestock management approach generated over $5 of total benefits. Of course, there's some uncertainty around this. In our best case estimates, it was potentially as high as $6.50. And even in our most conservative or sort of worst case estimates, it would still have been close to $5, so $4.70. We then also projected out the benefits that would have been likely based on this early trend to 12, 18, and 24 months. And the benefits, of course, just keep accruing from these improvements in nutrition and livelihoods and resilience. So at this point, I'll turn it back to Gwen to talk about the lessons learned.
Thanks a lot, Claire. So in terms of lesson learned, the key first lesson learned is very much the timing and duration of the intervention, but also when to do the data collection to make sure that we are seeing any actual impact. The second is that we confirm that milk is a key pathways as in line with the rest of the literature. But while what we also learn is, yes, usually livelihood intervention are very much associated with food security. But here what we learn is that beyond the effect on food security and household income, there is a need to carefully balance potential in unattended consequences, such as looking very closely at increased women workload and also looking at One Health pathway and especially those zoonotic risk. We also went back 1 year after the intervention to do a kind of qualitative study to try to better understand what the households thought about it and how it can be improved. And what we learned is households were satisfied with the intervention. Some of them were continuing to purchase small quantity of livestock feed. However, feed was remaining super expensive and not much available in the local market. They also continued to treating their water with chlorine, and even some neighboring household that began adopting those practices as well. Some spillover effect could be also further investigated. So what we know is those findings suggest that long-term or longer-term sustainability of the intervention would also rely very much on mid-terms type of interventions, such as the development of the livestock feed value chain, improving access and governance of water point, and strengthening the One Health surveillance. And then my last slide will be on more about, so what in terms of scale-up and implication for replication. So what do we know is the first priority is really to invest in formative research to tailor intervention parameter to the local context. So the conceptual framework show that intervention need to be adapted to seasonal dynamic, local livelihood system, existing institution. And this means identifying the right partners and institution, selecting the most appropriate delivery modality, adjusting the timing and duration to the local seasonality, and also adjusting the social behavior change strategy to the local knowledge and practices. The second is we need to move beyond this one-size-fits-all approach. So what worked in Chad might not work everywhere else. And even within a pastoral and agro-pastoral system, we see a diversity of livelihood system with implication on health management practices, seasonal strategy. And so there is a need for flexibility on adjusting those parameters. The last one relates on sustainability, because this was designed as an emergency intervention. And of course, it generates a substantial impact. But they should be combined with longer-term resilience building. So investing into livestock value chain to improve the availability and affordability of quality feed, investing on One Health system will be crucial to sustain those results. And then, yes, we think we need to open up and see that a lot, not FAO, but also a lot of partners are working on the operationalization of this conceptual framework of the context affected by malnutrition. So similar approach are already being implemented across Horn of Africa. For example, the ANANO project from Concert Worldwide. Also within FAO, we are exploring how to adapt and apply this framework in Afghanistan or Madagascar. Thank you very much.
Great. Thank you, Gwen and Claire. We really appreciate that. With that, we have several I'll turn it over to Taylor from our side to start moderating the Q&A, as we've had lots of questions come in.
Thanks, Julia, and thanks to our presenters. And hi, everyone. I'm Taylor Osborne. I'm the WASH Technical Director for ProWASH and Scale, and we'll be monitoring the Q&A. Please continue adding your questions to the Q&A. We've had several come in. I'd like to start with a question from the audience. So to what extent have you included household income and security factors in your livelihoods analysis, considering Chad is a Sahelian country?
Sorry, but maybe, so the question is about to what extent we included food security. So can you repeat?
Sure. So what extent have you included or considered household income and security factors into the livelihoods analysis?
So basically, we looked during the formative research, we looked at both, so qualitatively and quantitatively. So during the baseline, we looked at what were the main income sources and food security status and household asset, productive asset as a proxy to better understand their income and level. And second, during the qualitative component of the formative research, we also looked at those elements, and it was also included in the randomization process to make sure that they were comparable, and we control for it also in the impact evaluation. In terms of security, we monitor the security. It was also one of key elements during the baseline and during the monitoring system. So we only have 2 isolated cases of intra-community conflict that were not related to the intervention, and that we exchanged those villages during the intervention, and that was not related to the intervention. So that's how it was done. And then, yes, we also use secondary data such as the athlete to control for it.
I would just add that for the impact evaluation, measuring income is a very complex, to do it well, it's complex and a pretty big time investment with the respondents. So the study focused instead on measuring the more proximate sort of components of income, looking at, as I mentioned, births of livestock and distressed animal sales. So these are not, the ultimate income measure, but are certainly an important determinant of household income and the ones that were most closely tied to the intervention.
Great, thank you. Our next question is on the water quality piece of the intervention. And the question is whether water quality was monitored during implementation to assess whether households were correctly using the distributed chlorine supplies.
Yeah, we monitor free residual chlorine during the monitoring and also in the impact evaluation. And then we also, at the impact evaluation, measure the E. coli, a total coliform. And it was not presented here, but you can access those results in the full report.
Our next question is, how did the design of the livestock component differ from conventional emergency livestock feed interventions implemented elsewhere?
So basically, usually in what we are doing and the rest is we are focusing at the really end of the dry season to provide feed to the livestock that are already very weak or stop producing milk long time before. So the first difference was the duration. So we started at the time where milk started to decline. So the main objective was not only to keep the livestock alive and healthy, but really to keep this milk production. The second difference was also the composition of the livestock feed provided, because here we wanted to make it as nutritive as possible to have a good quality of milk. And so instead of maybe one specific component of either, usually what could be done is a supplement or only one type in Chad is usually cottonseed cake. Here we mixed with maize bran and some salt flakes, so it was more comprehensive and nutritious.
Great. And next, there's a question on the cost-benefit analysis. The participant would like to hear more about how the benefit on investment was calculated, as they imagine this could be very challenging.
Indeed. So we translated the various benefits. I don't know if you want to go back to the slide about that, maybe. I think it's like 4 or 5 slides back. So we translated the reductions in mortality and global acute malnutrition and applied sort of the sort of human capital potential to these using the minimum daily wage in Chad to translate into dollar terms. I don't know if that's a sufficient enough answer, but of course we could discuss this for very long. There are details in the full report.
Yeah, just maybe to complement. So basically, there was already some cost that we know, for example, how much it costs to treat a child that is already malnourished. So all of those were also put into the balance about what we invested and also the time that a household invested to attend the counseling session. And we put that in balance of, for example, the current value of one additional birth because of the goat, because then we know that they gain some new animals. So the idea was to value the price of a goat and then add that to the balance in comparison to what the intervention cost. So adverted treatment cost, new livestock asset, and also so those elements were put in the balance to have this idea of this return of investment.
Thanks for those additions, Gwen.
Thank you both. I'm going to move back to another WASH question. So the audience member said that achieving such results is not easy. From a WASH perspective, having the incidence of diarrheal diseases suggests very strong adherence to recommended practices. Could you share whether a specific approach contributed to these positive outcomes?
Sure. I mean, I think the long formative research, and maybe we could go to the slide that includes, thank you, for the social behavior change strategy and tools. I think the really intensive formative research was a large part of this. I mean, I think it's quite difficult to really break apart like the synergy between the livestock component and the WASH components. We did provide soap and chlorine, which certainly helps, and it was delivered multiple times, so there was multiple contact related to those behaviors. But clearly, I think households must have also found it to be a very salient intervention for them. And we have to acknowledge that these are all self-reported results. I mean, they're the free chlorine residual we have, and we do see improvements in that. We observed soap, but it is still hard to know truly, the balance between whether this is partially courtesy bias, or social desirability bias, people reporting what they thought we wanted to hear, versus, we didn't have clinic records or something to know validated that the symptoms were indeed reduced.
If I may add, that was also designed as very much integrated from the part of livelihood. So the idea of looking at what specifically looked at this, yes, I think there was a lot of interrelation about milk also providing maybe stronger immune system. So different interaction could have worked, and yes, the idea was, I think one of the key elements was this integration and multisectoriality, looking at those all different pathways working together towards the objective of reducing disease risk, but also improving nutrient absorption and anthropometric status.
And maybe just the final thing to add is that there was fairly frequent contact with the monthly SBC meetings and the varied types of engagement through which the messages were delivered to keep it yeah, interesting and engaging.
Thank you both. Our next question is asking, as this was intended to be an emergency intervention, do you know of any entities following up on aspects such as strengthening local supply chain for livestock feed or water supply governance?
This is definitely the next step. We are now actively working on the livestock feed value chain in Chad, and we are currently in discussion because this is definitely the next steps. So what we know in Chad is at the moment we are going in that direction, but there is also other contexts where it exists already. So in Somalia, for example, there are great examples from FAO, but also Nawiri project, where there have been like strong results on further value chain and linkages with milk production. So on the livestock feed value chain, yeah, work in progress, and we are putting a lot of effort into trying to make this happen. And same on the water governance. I think the idea is really trying to make it as this connection between sectors as much as possible to really link those aspects of water access, but within the overall framework of the local institution seasonality and use for production and livelihood systems.
Great. And now we've got a couple of questions focused on malnutrition. Did you see any difference in the prevalence of acute malnutrition based on the type of livestock produced? Example, a cow or camel, as opposed to sheep or goats?
That would have been great.
Yeah.
Actually, we didn't have, so most of our sample choose a small ruminant, especially goat. So there was very few choose to keep a camel or our cow. So we were not able, the power sample were not able power enough to look at those differences. But Claire, over to you.
Yeah, no, I don't have anything to add. Other than to clarify that, of course, it was the household's choice of the type of animals that they were using to meet the suggestion of one tropical livestock unit. The intervention did not provide the livestock, only the feed and salt lick.
Okay, thank you. Our next question is asking if you collected feedback on the design and the implementation of the program from participants and others in the community, particularly groups like young mothers. And if so, were there any highlights from their perspectives?
So there was two ways. The first one was during the monitoring systems, because there was some questionnaire, but also some space for any feedback during the intervention. And the second one is we went back 1 year after to meet women beneficiaries, so a young woman with children under 5, and trying to understand, okay, what were their feedback, and especially in the light of replicating and scaling up that type of intervention, what they would advise in terms of design and adjustment. So on this one, we had great feedback, and actually we made a short video with their feedback and lesson learned and advice. And I think you need to stay tuned, because it's now editing and in finalization. So you will hear more from them, directly from them, and we will put that online.
Great, thank you. And we've got a question from in French from a Francophone participant. So I've translated it, but apologies if I don't get it exactly right. There's a question related to the contamination of the wells. And if you have any ideas how contamination could be explained, even though they were saying their understanding is that the wells were protected and unexposed.
There was, so basically what we looked at, and this is more also explained in the full report, but we did different type of study to better understand the contamination of water sources. First, we did a tracker study. So basically we put a tracker on the jerrycan of some few women to better understand how they were using the different type of water source based on their choice, and understand within the same day or across different week how they were using them. So really to better understand, okay, maybe some of the protected borehole were the main water sources, but it seems that at the end, whole of different type of water source, included unprotected water source, were all mixed together and back to the household. So that was one of the elements that we looked, and we also collected sample from all of those water sources to better understand the differentiation of their contamination. So the protected borehole were the less contaminated among all the different type of water sources. So we had the pastoralist traditional wells, improved pastoral wells. So we looked at those diversified type of water sources. The second element that we did was also an analysis of contamination by type of water sources. And yes, we found, and I'm not a groundwater expert, so please apology. But what we found is, yes, even the protected borehole were highly contaminated, and there was some hypothesis done by our WASH specialist. Some of it were about the depth of the borehole and the possible sound infiltration by the soil, and also the linkages between the groundwater with the wadi that were at the end surface water. So there was some element about, yes, some hypotheses around what could be also responsible of the contamination of the different water sources.
Thank you. And we just have time for a couple of more questions. This participant says, thank you for the great presentation. They're wondering about the second annual peak of acute malnutrition, which it was highlighted during the context analysis, so the peak after rainy season. Were you able to capture that through the N-line survey?
No, so unfortunately, we did the second round of N-line in July, which is not the time of the peak. What there has been other study looking at the drivers of those peaks, and most of the hypotheses are leaning towards, yes, the depletion of the stock of cereal and just the time before the harvesting season. So some more pathway related to household food security and dietary diversity on those elements. But yes, this study really focused on the first peak that were usually less understood.
Okay, and maybe just one final question, and apologies if we didn't get to your questions. Just maybe a nice closing. How did the reductions in GAM and SAM prevalence reported in this study compare with findings from similar studies conducted in comparable settings?
The one I know, to the extent of my knowledge, I think we can compare, for example, with the one done in Kenya that was called Livestock for Health, and was not exactly the same design, because in Kenya, the one only focused much more on livestock feed and did not include this One Health approach. And this environmental contamination, and we saw in Chad much more higher impact than what we've seen in. It was significant in Chad, but to much lower level. So, and then maybe Claire, you have also other type of example you have in mind about.
No, I don't. Yeah, I think this specific focused on the dryland context is, I don't have much to add on that.
Great. Well, thank you so much for all of the great questions that came in from the audience. We're just about out of time, so I wanted to pass it back over to Julia to close us out.
Thanks all. So first of all, thanks everybody for joining and for these great questions, and particular thanks to Gwen and Claire for their great presentation and their work on this. It's really appreciated. After this, we will kind of, as noted, we will be sharing out the slides, recording, and PowerPoint with everybody who registered. And we will also be sending kind of a form for you to kind of input what you liked, what you think went well, any kind of suggestions you may have for us moving forward. So thanks for that. And then if you want to sign up for more events, please kind of join our newsletter. And thanks again. Have a great rest of your day.